Okay, let's review heat in the heart, tongue diagnosis. This is a continuation of the topic last time. And we presented four cases, no? Number one, which tongue feature in the 34-year-old patient specifically indicates heat in the heart combined with blood deficiency?
Mhm. Number two, long, narrow shape with red, flattened tip and red points.
Okay, the flattened tip, when you see a uh,
Tip.
flattened shape, tawag dyan. That's a sign of deficiency talaga. Good. In the 36-year-old female, the presence of a slight midline crack on the tongue most directly suggests which TCM deficiency.
Stomach yin deficiency.
Okay. Yeah, this can also mean that when you have stomach deficiency, there's no coating. No, that's why you could see the crack already. The white thin dry coating on the 44-year-old psoriasis patient's tongue is interpreted in TCM as indicating which external pathogenic factor.
White thin. When cold.
Yeah, wind cold. Do not be confused with the dry coating. Actually, matagal na, the dry coating there is probably due to the psoriasis. No? However, the coating is white and thin.
Mhm.
So medyo predisposed siya sa wind cold. Which combination of symptoms best aligns with the TCM diagnosis of heart blood deficiency with heat in the heart, as seen in the 44-year-old case?
Scratchy throat, backache, and severe stage fright.
Yes. For the 75-year-old hypertensive patient, the pale edges of the tongue, I hope you still remember the tongue, no? Are most indicative of deficiency in which organ systems?
Mhm. Uh, Spleen, chi, and liver blood.
Great. Which of the following background factors is most likely to contribute to the accumulation of turbid dampness noted in the 36-year-old tongue coating?
Mm. Caffeine abuse and irregular eating habits.
In the case of the 34-year-old with lichen sclerosis, the long, narrow tongue shape primarily reflects what constitutional tendency?
Heart chi deficiency.
Right. Which symptom listed for the 34-year-old patient is most directly associated with heart blood deficiency in PCM theory?
Right. Uh, Strong menstrual pains.
Mhm. The curled up and red tip on the 36-year-old's tongue signals heat in which organ?
Heart.
Which of the following best describes relationship between yellow old dry coating and organ pathology in the 75-year-old patient?
Heat in the stomach with the onset of stomach yin deficiency.
Okay. Yeah. Considering TCM theory, which emotional factor listed is most likely to aggravate heart blood deficiency in the 44-year-old patient?
Divorce.
Yes. Ouch. Okay. Which of the following tongue characteristics is not kasi grabing impact ng divorce, di ba?
Yes.
Which of the following tongue characteristics is not present in any of the four cases described?
Um, Thick white spur covering the entire tongue.
Yeah. The presence of strong menstrual pains combined with night sweats most likely indicates deficiency in which TCM organ pair?
Heart and kidney.
Heart and kidney. Okay, yeah. Which case explicitly mentions a stroke as part of the patient's medical background? This is very.
The the 75-year-old with hypertension.
So remember, ang tagal na niya hypertensive, no? Uncontrolled. Which of the following symptom clusters would most likely be interpreted as external wind cold in TCM?
Scratchy throat, backache, nervousness.
In the 44-year-old psoriasis patient, the pale red, slightly bluish tongue coloration suggests what subtle pathological change?
Blood stasis.
Which of the following best explains the significance of red flattened tip with red points in the 34-year-old's tongue?
Um, she has heat in the heart with blood deficiency.
Flattened blood deficiency. No? The 36-year-old slightly yellow greasy coating is most indicative of which pathogenic factor?
Turbid dampness.
Which patient's tongue description includes a pale edges feature, and what does it signify in TCM?
Uh, the 75-year-old has spleen and liver blood deficiency.
So sabay talaga, no? Of
Yeah.
course, kung meron kang spleen deficiency,
Spleen there's liver
walang may
blood.
isto yung liver.
Yeah.
Which emotional state is not listed among the backgrounds of the four patients?
Joyful celebration.
Sila happy lahat, no? In TPM, a curled up tongue tip most commonly indicates heat in which organ system?
Heart.
Yeah. Which of the following symptoms is shared by both the 34-year-old and the 75-year-old patients?
They both have insomnia.
Yes. The long, narrow tongue shape is most likely a manifestation of which constitutional weakness?
Uh, deficiency of hearts.
Which case includes knee pain upon exertion as a symptom, and what TCM organ is most closely related to this complaint?
Uh, the kidney of the 36-year-old.
Okay. The presence of severe stage fright in the 44-year-old patient most directly reflects an imbalance in which TCM element.
Severe stage fright. What? Fire?
Yeah, kulang siya sa fire. Which of the following tongue findings would most likely be observed in a patient with stomach deficiency according to the cases provided?
Light midline crack.
The 75-year-old's weakness and heaviness in the left leg is most consistent with deficiency in which organs? Chi.
Uh, liver.
You have to also be particular about this, no? Weakness
Left.
and heaviness in the leg. Which combination of tongue color and coating best matches heat in the stomach with onset of stomachache deficiency?
Mm. Yellow old dry coating.
Okay. The term heart blood deficiency with heat in the heart appears in how many of the four case descriptions?
2.
Yes. Which patient's tongue description includes both pale red and slightly bluish coloration? And what does the bluish tint suggest?
Blood stasis on the 44-year-old.
According to the case notes, which lifestyle factor is most directly linked to the development of turbid dampness?
Caffeine abuse.
Which of the following is not a symptom reported by the 36-year-old female?
Severe itching.
The red pointed tip on the 75-year-old's tongue is interpreted as heat arising from deficiency in which organ?
The heart.
Which case explicitly mentions externally contracted wind cold as a diagnosis based on tongue coating?
Mm. 44-year-old with psoriasis.
Which symptom pair is most indicative of heat in the heart according to the case presentations?
A severe stage fright and nervousness.
Which patient's condition is most likely to benefit from herb formulas that clear heart fire?
44-year-old with psoriasis.
Which symptom is uniquely associated with the Western diagnosis of psoriasis in the case set?
Formation of pustules on skin.
Considering the 75-year-old's background, which TCM concept best explains fear of dying as a symptom?
Heart fire.
Yeah. So heart fire, key, fear of dying. Which of the following is a common factor between the tongue descriptions of the 34-year-old and the 36-year-old patients?
Both have pale red body.
Yeah, signifying deficiency. The yellow, old, dry coating on the 75-year-old's tongue suggests the presence of which pathogenic element?
Dry heat.
Which emotional stressor is listed for the 36-year-old and could plausibly aggravate stomach yin deficiency?
Marital problems.
Which of the following best describes significance of night sweats in the context of the 34-year-old's tongue findings?
Mm,
Night sweats.
Symptom of heart blood deficiency with heat.
Yes, because this will definitely go to heart yin deficiency, no? Which case includes a symptom that directly reflects a dysfunction of the stomach organ in TCM theory?
Uh, 36-year-old with strong stomach ache and pressure feeling.
Based on the provided data, which patient is most likely to exhibit liver yang rising if the condition progressed?
The 44-year-old.
Of course. Kasi meron na siyang ano, di ba, mainit. The pale edges of the tongue in the 75-year-old case are indicative of which two deficiencies?
Spleen and liver blood deficiency.
Which of the following is not a tongue characteristic mentioned across any of the four cases?
Cracked dorsum.
The symptom pressure in the stomach combined with stress-related stomach ache most closely aligns with which TCM pattern?
Stomach chi stagnation.
In the 44-year-old case, the white thin dry coating is most consistent with which TCM diagnosis?
External wind cold.
Which lifestyle factor appears exclusively in the background of the 44-year-old patient?
Divorce.
The strong menstrual pains reported by the 34-year-old most likely indicate a deficiency in which TCM organ?
The kidney.
Yes. Which of the following best explains the presence of yellow old dry coating in terms of disease progression?
Chronic heat drying fluids.
The white thin dry coating on the 44-year-old's tongue suggests an invasion of which external pathogenic factor?
Wind cold.
The combination of insomnia, fatigue, depression in the 75-year-old most closely aligns with which TCM organ deficiencies pattern?
Heart chi deficiency.
Wow, walang mali ah. Congratulations, Ma'am
Thanks,
Trix. And I'm sure in-internalize mo talaga yung kaso, no? So I'll see you again all tomorrow and thank you for joining me in our review, no? So see you again tomorrow, 4 o'clock. Maraming salamat po. Thank you, everyone. Bye.
Thank you, Doc.
Thank you. Thank you.
Thank you, Doc.
Thank you, Doc. Thank you, everyone.
Thank you
Ulit.
very
Thank you,
much.
Ma'am Trix, Doc She. Bye-bye.